listening today and watching our webinar. We're very excited to have with us presenting this webinar today Sam Taylor, who is our Director of Product Management and has been steeped and very much involved in the last several weeks in finalizing and getting the data standards updated, and very much we're all excited to hear the changes and how they can impact our organizations. So at this time, I'll turn the time over to Sam, and as you participate and listen to the webinar today, please make sure that you use your webinar, your GoToWebinar chat or a comment screen if you have any questions, and we'll look at those questions at the end and address those. So at this time, I'll turn the time over to Sam Taylor. Thanks, Sam.
Thanks, Steve. I appreciate it. Welcome, everybody. It's very exciting to meet with a group of individuals who are excited and enthused about the new changes to HMIS Data Standards as much as I am. I see we got quite a few people joining, and I'm happy to see quite a few names that I recognize, either folks I've worked with in projects or maybe encountered in other ways. So welcome, everybody. As Steve mentioned, we will have time for questions. We'll be fielding those through the questions panel and GoToWebinar. So please send them in, and I'm happy to say we've already got quite a few in there. So let's get started and make sure we use our time productively here. You should be able to see just our intro slide here, and we're going to move into an outline. So this is what we'll be covering today. So we're going to talk about HMIS compliance and context. It's helpful to remember that in a webinar like this, we have a wide range of knowledge and familiarity with HMIS. So we're going to talk just a little bit about context. For those of you who are new to HMIS or maybe just slightly familiar with it, we're going to try and explain the context for the data standards a bit. Then we're going to move into the actual data elements and the requirements. Okay, we're going to talk broadly how to understand them, and then about a few specifics. And speaking of specifics, that'll be something we highlight there in the critical changes section of today's webinar. And these are areas that will impact you greatly. Whether you're a ClientTrack customer or not, if you are doing HMIS, these changes will be a pretty big change, and they're definitely worth paying attention to. And we'll talk a little bit about what those changes are and how they might impact you. And then finally, we'll talk about some details about ClientTrack's HMIS solution. Okay, along with that, not just talking about the features, but also those of you who are working currently in a ClientTrack solution, some very specific information about you for your planning this month, and what we're going to do to make sure you're successful in this next month. Okay. Let me move forward here. So HMIS data standards and context here. So really quick, what is an HMIS? HMIS is an information system, okay? And it's designed, it's managed by a continuum of care. And, at least the basic intent is to fulfill federal guidelines, okay? This, of course, is the reason a lot of people have started using HMISs. Those of you who do and participate in an HMIS, that usually comes from some type of regulation. Now, I do want to highlight here that beyond regulation, there's a lot more going on with HMIS data, okay, a lot more. HMIS data influences policy. So this information that you gather and you work with in an HMIS is given to a lot of decision makers in Washington and in your local states and other areas where they decide on policy that might affect people who are experiencing homelessness or people who maybe have housing stability or worries there. Okay, so it's very important data that helps people make the right kind of decisions, okay? Because without the data and without the information, we're always making a lot of assumptions and possibly problems, and that certainly happens at the policy level. So beyond just compliance, understand that HMIS data feeds into policy, and the hope is improves policy. Now another thing, and this is something I've seen in many areas, is that an HMIS helps an individual community improve their outcomes. Okay? An HMIS allows a local community to have a standard set of data to work with so they can understand the breadth of the problem of people experiencing homelessness in their community. They can understand some of the demographics, some of the unique challenges. They can also understand maybe areas where they need to focus their attention. Two of these that I think is extremely important are chronic homelessness and veterans. Right? And without the data, it becomes very difficult to prioritize services. It becomes very difficult to really understand the breadth of issues and understand the contours of problems in your own community. We also have here, I just wanted to show a little impact. This is HMIS data in action. So those of you who follow all the lists for like HUD Exchange, the Veterans List, and so forth, probably saw this announcement yesterday, and the decline of 33% in veterans homelessness since 2010. So that's a pretty amazing thing for us to celebrate. And in many ways, data, first of all, helps us tell that story. But it also helps communities identify veterans, work closely with veterans, and understand outcomes with veterans. Okay. Oh, looks like I'm having just a little bit of an issue with the screen here. If you could, I'm going to pause for just a moment. All right, we're just trying a little switch of the screen here. Looks like I'm still having a couple of problems. Hold on just one moment. Screen issues, so just 1 second. Okay, so if you were wondering what all that chaos was, we were just making sure that the presentation was appropriate for screen size. It looks like I got a lot of comments there. Thank you for drawing my attention to that. On my screen, it seems perfectly fine. So if you see anything else like that, any audio and video problems, please let me know. Thank you so much. Okay, so we were just talking about veterans homelessness, this 33% reduction, which is something everybody who has worked towards that goal needs to be proud of. But it's also something that data had a big influence on. Without data, you couldn't have told that story. Without data, you probably couldn't have provided prioritized services in communities to help veterans. So very important in that way. All right, so why the change to data standards? Okay, we think of data standards being around since the 2010 version. So what are some of the reasons driving this change? Okay, now first of all, it's the HARF Act. So when we think of HMIS, we're always going to think of the federal regulations. The HARF Act included a number of changes, including coordinated assessment, which I think, even looking at the panel, the attendees, I think I know some people who have worked on that projects, and I've encountered them a little bit here. Coordinated assessment was part of that, and a lot of other aspects of these changes was driven by the HARF Act. Now, another important piece of context as you're thinking through the data standards is HUD's federal partners. So the HMIS system, the HMIS approach, I like to think of it as being so good it's drawn other people in. So other federal programs that are interested in working on housing stability have seen the value of an HMIS, have seen what that data can do, and have wanted to participate in that. Now, of course, part of that participation is additional data elements, maybe some priorities that are slightly different than HUD's or some of the original intent of the HMIS data elements. So you see some changes driven by that participation and partnership with other federal programs. VA, of course, is one, and I think many of you have encountered that with the SSVF grant. Now, beyond this, so, we've talked here about really compliance-driven changes, so we have to do it because of federal regulations and so forth. Beyond that, there is an intent behind these standards to improve an HMIS. Okay? So there are areas where you see clarity, increased clarity, and formalization, okay, where maybe it's always been implied or assumed you would get this kind of information, but HUD has made it much clearer now. You also get areas where some of the elements have been simplified and reduced even, and you'll actually hear more about this when we talk about the ClientTrack features. Because of the changes in the data standards, we were able to simplify things like a project entry workflow, a program entry workflow, that is. Okay? Also standardized there. Many of you who have worked on your AHAR, and I know at least a couple of you have worked on AHAR, one of the things that have has been a source of struggle is the inconsistency between how the AHAR does something or the APR and other reports as well. So you see a lot more harmony between the data standards in this version, okay, in the 2014 version. Now, moving right along here, let's talk about just compliance in general. So first thing to know is compliance can be a bit challenging. Okay? So compliance requires you to understand what the data standards are, what those data elements are. And when you think of the data elements, it's not just a list of data that you have to collect. It's the rules about when you collect it and what format that data is in. For example, there are specific categories of data related to health insurance or related to ethnicity and race. Many people have seen that before. Okay? So there are definite, like a certain standard that you have to meet in the data collection where it's not just gathering gender, but gathering gender according to the categories and the rules defined by the HMIS. And as many of you know, these rules can be challenging. In fact, we'll have a few suggestions here. But some of these rules are things that I hear from administrators all the time, that their communities aren't sure exactly what to do, that they have questions about this rule or that rule, and that's all just about gathering the data. Now, beyond that, compliance is also reporting standards. So, ultimately, a lot of the data we collect is about how we can report and analyze that data. And how that data looks on the report is dependent on what the data elements allow for, and then also kind of the underlying logic related to those. One of the changes we'll talk about later, and those of you who work with ClientTrack you'll definitely see in the near future, is the APR update. So the new standards have changed some of the data that appears in the APR, and HUD has provided kind of a temporary APR guidance to say, here's how you report in those areas that have been affected by the change. Okay? Those are generally called programming instructions, and those are things that, for the most part your vendors work with, and then you of course can find those on HUD Exchange. They might still be on one CPD, but I don't know if everybody's moving to HUD Exchange. But anyway, you might be able to see them there. But these are really precise things that really a programmer can sit down and decide how to write their queries to pull your data. Even beyond the programming instructions for reports and the data standards, you've got your CSV and your XML. Many of you work with either exporting data from a system. SSVF grantees certainly know about this. But you may also move data between one system and another using either XML or CSV. Well, those standards for exchanging data have certainly changed, okay, or been impacted by these changes, and they're dependent on the compliance requirements. Now, just to give you a sense, so here's kind of the challenge there with compliance. Some of the things that we do to stay on top of that, first of all, we're actively engaged in the vendor community. The HMIS vendor community is active. I work with products in other arenas, so to speak, and really the HMIS one is interesting in that we've got regular communication from HUD and other folks there, from TAs. We also get updates and other things kind of pushed out to us in a way that's really appreciated. And there's vendor meetings yearly or sometimes even twice a year where we get together and we're able to talk through some of these issues. We've been involved in that process, engaged in that process for quite a few months. Really with these 2014 data standards, we were looking at elements of those and discussing elements of those as they evolved over the past year or so. All right, so let's move into the elements themselves. Hopefully at this point you have a good grasp of the context of HMIS data standards, where they come from, why they're changing, and so forth. Okay? Now, if you happen to have a question about any of that, please put that in the questions panel. We'll be reviewing those and answering those towards the end of this session. All right, now, it's helpful for me to break down the data elements into a few categories. This helps me get my mind around them. Huh? Now, first of all, there's project descriptors, okay? And these are data about the programs and the funding sources in a community. Okay? And we'll talk a lot more about those. And we'll talk a lot more specifically about the term project, because it will take maybe a little bit of translation for you, and it's a new piece of terminology that we'll explore in depth a little later on in the presentation. One thing that I like to remember about project descriptors is this is something that should be managed by an administrator and probably updated annually or even more often, more frequently. Okay? End users probably shouldn't have to interact with this data very much. And in fact, if they are, that might be putting the data accuracy at risk a little bit. So the people who are the administrators, sometimes that's technical or a little more on the program side. You also have a lot of folks who work with this that might be a grant manager or somebody designated by a lead agency to overview that. You might even have individual agencies that look at that data sometimes. We also have the universal data elements. All right, so these are required for all continuum projects. These are the data elements that everybody at your organization will need to work with. Okay? And we'll talk about a few of those today, but as I make recommendations for how you can read more and understand more about this, I would suggest that you spend quite a bit of your effort in understanding these on the universal data elements, because those will affect the broadest range of your users. And we also have project-specific elements. Okay? Now, these elements are required only for certain types of projects, and already here we've got to talk a little bit. When we say program here and project, it's kind of the same thing. We'll explain that a little bit further on, but how does move towards the terminology of project there. Also, the funding source drives some of those changes. So, for example, the HOPWA as a federal program, that as a funding source requires different data than some of the other funding sources. One reason this is important on the program-specific elements is one of the challenges when you're recording this data is for somebody who's interacting with a client, putting data in the system, for them to know the specific rules of data collection that apply to that situation. So if you bring somebody into an emergency shelter, what are the different requirements that apply to you than if you have somebody involved in maybe rapid rehousing or something like that? Okay? And we'll have some guidance here throughout the presentation today, but I'd encourage you, in the ClientTrack system, we use a lot of conditional logic and other things that helps guide people through that. So your users don't have to remember those things. They have to know every single requirement. The system itself will use logic to make things required or appear for them. Okay? And more on that later, by the way. Now, finally, we have metadata elements, which everybody likes to say it's data about data. And these are things that most databases already have, like the data record was created or updated, those type of things, data. And for the most part, the ClientTrack systems have already collected this. It's already been available, and these are really best practices that help people work with data in terms of reporting and analysis and, even auditing and things. Okay. So those are the 4 major types of data elements. Now I want to talk about a couple of tools for understanding these. Now the first is the data dictionary. And I want to preface this with the data dictionary is really low-level technical explanations. For the most part, this is a tool for vendors. This has been our primary tool in developing and configuring the 2014 service pack for HMIS. This has been a tool that we've looked at constantly, and it's very, very helpful. At the same time, it provides the type of information that are more interesting if you're looking at report or form logic, forms for data entry, that is. If you're trying to understand policy or you're trying to understand how to answer questions in the right way, this may not be the right tool. And for the most part, people who are actually performing the work and doing this data collection, this is probably not the best tool for them. I'll mention that one in a moment. Before we move on to that tool, I do want to just highlight a few areas. So you've got your element name. Those of you who will be working with a ClientTrack solution, that's how we'll reference the data element. You'll also see the number, like 3.8 in this case, a disabling condition. That will also be a reference in your release notes and other ClientTrack materials. You also see here a field and response, and you see a number 1 there. Now, anytime you see a number 1, you know other numbers can follow. It's important to note that with some data elements, there are actually multiple responses for that element. We'll see an example of that with 3.17 here in a little bit. This is important to understand because you want to just think a little bit more broadly than one piece of data, but instead it's kind of one concept you're collecting with each of these data elements. You also see in here disabling condition, and then we've got a little table here. Now on the right-hand side, you're seeing the labels. You're seeing kind of the response category that as human beings we'd interact with. On the left-hand side, you're seeing the values, and that's kind of more of a technical explanation of it, that you would see in data exchange and maybe other contexts. It's important to note here, the 0, 1, 8, 9, 99, you should never have to interact with that, or at least if you are a user of a system doing data collection and reporting, you shouldn't have to interact with that. Now, if you're a technical administrator, that could become pretty important. If you're writing in-depth reports, that might be pretty important. And if you were having to delve into some of the exchange formats like CSV, that might be important. But for most people doing data collection and using an HMIS, that doesn't matter to them. Okay? You'll also see here a few other interesting things. The type element, universal here, or you'd see program-specific or project descriptor and so forth. What type of project it applies to. Universal applies to all, but in the data dictionary you might see something different for program-specific. which would break out the funding source and the type of project that people that would apply to that data element. We'll talk about a couple of those a little bit later on in the presentation. Okay. You also see the funder, who the data is collected about. Now this is really important. You see here all adults. Okay? So we shouldn't expect to see this data about children. Okay? There are some variations of this that we'll talk about later on in the presentation. Okay? Now I don't want to dive into too many more details. Hopefully you can see there some other useful information. But in interest of time, we'll skip forward. Oh, apologize. The tool that I want to encourage all of you to get, if you haven't got it already, many of you already have this, is the data manual. Okay? This is intended for staff or, at least people who are working more in the program end. So if you're a trainer and one of your responsibilities is training staff on the new data collection, this tool will be very, very useful for you. It explains why something's a data element. It explains when it's collected. It explains who you're gathering the data about. Okay? This is something that I definitely encourage everybody to take a look at. I found it very helpful, and just a quick side note on the ClientTrack solution side, we have taken snippets and quotes and other things from this data manual and put them in the system as instructions to users. You'll see that throughout the system where subject headings or help icons will display sections from the data manual that will help a user answer questions about, okay, well, how do I ask veteran status? Well, there's a little help icon. You hover over it, and there's the suggestions from the data manual. Okay? Lots of other things included in there. I think for many of you who are prepping for this, this might be a big takeaway from today. Get that manual and start learning from it. Okay. Also, as we move into new data standards, let's be clear that it's not just about new data collection. When you change data collection, it impacts every aspect of the system, or at least most every aspect. Okay? So these are changes to reports, exports, imports, and many other features of an HMIS. All right? Those of you who will have the opportunity to read our release notes for the service pack next week, you will notice a lot of attention has been paid to which reports and other features have been impacted by these changes. Now for some very specific information here, programs versus projects. This will take some rehearsal to get used to. Some of you are already hearing this terminology, are familiar with it. So if you attend like NHSDC, some of the other conferences, you're probably already used to this language. If you don't, this is something that you'll want to spend some time on. So for the purpose of an HMIS, in HUD's world, a program is a federal funding source. So the HUD COC, Health and Human Services PATH, the VA's SSVF, those are federal programs. Okay? And I like to add in the qualifier federal before I say program there, because it helps me differentiate that between what we in the Health and Human Services usually call a program. Okay? A project, okay, this is a distinct unit of an organization that provides services or lodging, okay, or shelter, whatever you want to call it there. Okay? Now, this is what we normally call programs. And I think in most systems, most information systems, you are used to calling this program. Okay? In ClientTrack, you will notice that we still call the setup data program. But when we talk specifically about requirements for HUD, like a project type, you'll see the appropriate labeling there. This is to remain consistent with human services in general, but also give you the terminology that would make it easy to look up something in a HUD standard. So practice this, programs versus projects. Definitely something you should keep in mind before you read the data manual, because the terminology would otherwise be confusing. So let's talk a little more in depth about project types and a few changes there. I have a table there on the right-hand side that lists out the new project types. You should see some old favorites there, but also a few variations. So homeless outreach is now street outreach. Okay? Now, homeless prevention and rapid rehousing are distinct categories. Those of you who've been with us know that we did have a release that already addressed this to a certain extent, which should make this change a little less painful. You also see that a PH is added to permanent housing projects. And then there's a new type of program or project called coordinated assessment, okay? Which should be interesting to probably everybody on the phone if you're working with an HMIS. A couple other things. You'll notice that with services-only programs, there is some additional project type data that you'll see. If the services-only programs affiliated with a residential project, you'll have to answer yes, they are, and you'll associate that services-only program with a residential project. Okay? Now, this is so you can see housing outcomes related to the enrollments and the other activities of that services-only project. Okay? So it's all about better outcomes and the most important outcomes, which is housing outcomes. Okay? All right, so that's a big one. Definitely keep that in mind. Now, funding sources. I took a table directly from Data Manual, I believe, or the Data Dictionary. You see the grant program over there on the left-hand side, the federal grant component in that middle column, and then the project types that are funded by that particular grant program and the component. So, for example, if we are looking at, now what one that has a few different ones, if we are looking at permanent supportive housing, which includes, under COC, so continuum care for the homeless, we've got our PSH type, and this includes the shelter plus care, supportive service, so forth. You can read that, of course. That applies to the project type, permanent supportive housing. Okay? Now, this data, we're still in the project descriptors area, and this is data that your administrator will need to know. Okay? And ClientTrack has adopted this terminology, so it should be a little bit easier for you. Okay. Now, we're kind of transitioning here from, we're talking about some of the changes. We're in the critical changes section here. And veteran status and disabling condition are a big change. Okay. Now, it was previously that you collected that as point-in-time assessments. Is the person a veteran at this point in time versus another? For consistency, data accuracy, and so forth, now, both these, veteran status and disabling condition, are part of the client record. This impacted ClientTrack reports, dashboards, Data Explorer, a number of other places in the application. Okay. And I'm going to move along a little faster pace in the hope that we can get through everything and have time for a lot of questions. Another critical change is when you think about a head of household. Okay. There's one head of household for each project entry, okay, or program enrollment. Remember the terminology there. Okay. And this affects data collection and reporting. One thing to note here, for those of you already using a ClientTrack solution, this is something that's already largely part of every ClientTrack solution. It's not as big of a change in our system as maybe other places. A quick note here about changes. When we talk about affects data collection, we look at adults and heads of household as the requirement from HUD. Okay? Those are and that would involve minors who are head of household would get that data collection. So that's why that's important. We also see this change on the APR, which is where we used to talk about adults and unaccompanied youth. We talk about adults and all heads of household. Okay? So important change there. All right, this is a very big change, something that I think will be very important for folks because of how important chronic homelessness is. Okay? So chronic homelessness had been gathered in a way that you gather some data about it, some supporting data, and then a lot of areas you could just select yes or no if the client is homeless, chronically homeless, that is. This has changed. This has changed in a couple of significant ways. It's changed because you can't just answer that question directly. Instead, the questions are what supports answering whether or not a person's chronically homeless or not. You can basically calculate it based on the data. You can also, by calculating how many months somebody's been homeless, here we can calculate when somebody becomes chronically homeless. So this, in my mind, is a great advantage in systems because that was kind of a challenge. Is, you know, we got somebody, we identified that they were almost chronically homeless. How is it we make sure that when they become so, we're looking at their data? So big change there, and that's just a screenshot of what it looks like there in ClientTrack. A few notes on our approach and also a few features of the ClientTrack HMIS solution. So first of all, we want you to know that there are challenges to complying with the new standards. And I think those of you who have been working with an HMIS for many years have seen this before. Okay? And you do know it is challenging. And there will be kinks to work out, and there'll be challenges. There'll be updates to standards. There'll be other things. We just want to emphasize that part of working with ClientTrack is that we're going to help you meet that challenge. Okay? We're going to work with you directly. We're going to make sure that you're successful with this. I'm going to walk through a few features here. So first of all is a workflow. Now, those of you who use workflows in ClientTrack probably use those for major data collection points like intake, annual assessment, and exit as three common examples. We have in the new solution two workflows that will help you meet these needs. Now, you might be thinking to yourself, all right, if you look at project types, how many there are, and you look at federal grants and federal grant components, that's a lot of complexity. And if you think about the complexity added on by data is not collected the same for adults and children, heads of households and not heads of households, there's a lot of moving parts, so to speak. Right? So what we've designed in the solution is workflows that are going to look at the data you're collecting and then adapt to that data to show you the right elements, to make the right elements visible or required, and also make sure that people don't need to collect all that data are not being forced to through required elements or visible elements. Okay? There are two main workflows that you'll have in the release. One is the program data intake, and this is where the vast majority of your programs will use for entry and updates as well as the workflow. So if you support really emergency shelters, for the most part, those of you doing night by night, which is quite a few of you, that one actually has some optimized forms to help you with that. But if you're doing most of the COC programs, this will be the workflow for you. Those of you doing SSVF, if you have a HOPWA grant and so forth, this will be the workflow for you. Okay? Also want to highlight the outreach workflow. Okay? So if you have an outreach program, and this includes past-funded programs, you'll use this workflow, which is reduced, a little more focused on what an outreach program needs. Okay? Now, a quick note here, and we'll talk a little bit more about this later. You may already have workflows that meet your own community's data collection needs. So please understand you're not required to use this. And those of you who have some of those more individualized and community-based workflows, we're going to have a path to help you on the new standards. So we'll talk more about that later. But I just want to assure you, you're not getting a dictate that says you must use these two workflows. There's certainly ways for you to take what you have and make it work with the existing, with the new standards, that is. Just a few other notes here. Coordinated assessment. This is always a challenge for a standard feature because it's so community specific. But there is an important update in the new standards for housing assessment, which includes a housing disposition. There's also the fact that you have a project that you can actually do an entry for. It's called coordinated assessment. form, and an example of that workflow will be deployed in our standard coordinated assessment. This is really a model or kind of a foundation to start with for coordinated assessment. As you know, your coordinated assessment is going to be specific to your community. So I would highlight this as something, if you have a coordinated assessment in your HMIS right now, highlight that fact and look in the release notes to the section on coordinated assessment for direction there. Okay. Also for emergency shelter, most emergency shelters we recommend using our shelter check-in and a couple of other features. You should already be used to using those if you have shelters that way. So those forms will be updated to the new standard, and you should be able to use them basically how you are now. Also in the new solution, there are 4 standard work groups. And those of you who may not be familiar with ClientTrack, work groups are about an interface that is configured to meet the specific needs of a type of user. Okay? These work groups will be useful for you in a couple of ways. One is as a reference, so you can go in there and look at what features are available, what new features were added in. Also, if you have users that you need to bring on, or you have your own work group ideas that you want to build from, these might be good foundations for you. Now we have an HMIS programs. This work group should fit the needs of almost everybody. Okay? This should be your default if you're not sure about the other 3 being a good fit. And really the other 2, because the lead agency one, this is really a place for administrators. So those of you who do administration. The HMIS emergency and day shelter, this is for those of you supporting emergency shelters. There's optimized forms for you. There's a check-in tab and other things that you should already be familiar with. Okay? And we also have the street outreach. So in the past, street outreach has been something that's been configured on a community basis. In the HMIS Service Pack release, you'll have a good foundation for that if you have a street outreach program. Another feature, this one's pretty big. So if you see on here that the form, the screenshot here, those who are used to this, used to a ClientTrack system, will notice something missing, and that's grant. Okay? It's been in the past that it has required you to select a single grant to enroll in a program. Okay? Because of changes to HUD's data requirements, this is no longer something we have to do. I've worked in many projects where this has become a real challenge. And the challenge is a couple of things. The first is most programs are funded with some combination of funds. It's not easy to say that all of my enrollment was funded by Grant X and this other enrollment was only funded by Grant Y. I think the reality of funding human services programs just doesn't fit that. Blended funding is a common term for that. So it's kind of nice now that you don't need to worry about that. If you have multiple funding sources that fund a program, you got a solution now. We also have here that HMIS users don't need to worry about what grant to select. I've seen this as a problem, where your end user doesn't know what your grants are. Okay. They don't know the specific names of them, and sometimes this presents challenges. Okay. Last thing here is it improves administrator control. So as an admin, you set up your programs, you associate them with the appropriate funding sources, and you manage it at that level. You don't have to worry if the data collection is happening on the enrollment form. Okay. A couple of other features to be interested in. New setup forms. These are optimized for HMIS programs. Okay. We'll also have the concept of aging into, which is forms that will help you identify clients who are getting close to age 18 and need an update in their data. You will get an updated APR for COCs. This should be very exciting. Quick note there, it'll be mentioned in the release notes, but we'll update the entire APR release notes for you. And then finally, and I apologize, I didn't get a graphic to say bon voyage, but HPRP is gone, basically. Now, you'll see this in a lot of the HUD information, and in ClientTrack you won't see a work group for it. You won't have all sorts of forms and other things assigned to it. for all intents and purposes, is basically gone. Okay? Now planning, we got just a couple of slides here on what you need to do next if you're in a ClientTrack solution. So first things first, read the release notes as soon as you receive them. That should be next week, early next week. And I'll explain a little bit on how that happens. But read them thoroughly, present the questions you have for us. And I want to highlight a few sections that I think are very important for you. Set up data changes, put that on your checklist. The section that talks about what's the appropriate workflows and work groups for certain types of users, and think project type here. Those of you who configure a ClientTrack system, there is an implementation manager's appendix. This is the nitty-gritty details of the solution. New drop-down lists, new IDs, new logic, how to work with that, how to build on the foundation to make your own solutions. Also a section on critical forms. Those three forms are extremely important. They've met up with the most significant changes. So keep those in mind, the universal data, enrollment, and the client intake. Okay? And then also, I would suggest you look at the sections for SSVF, PATH, and HOPWA to make sure that you understand the specific instructions for those. All right, so those of you in a ClientTrack solution are probably wondering, okay, well, what's the logistics? Who, when, what, where, all of that. Okay? Your client advocate will be in contact with you next week. The client advocates have been working on a plan so that they can address your needs. Okay? We have a list of you. We will proactively reach out to you. For those of you who we're not already involved with. Okay? And then finally, a few things to make sure you talk about in that conversation. Your import and export needs, when your APRs are due. Okay? And if you've got APRs due in October, highlight that. Make sure you put a lot of attention to it. Any operational reporting you have that might be not considered a standard ClientTrack report, your coordinated assessment, and then if you have any configuration projects that are a work in progress, please talk about those when you talk to your client advocate. Okay, questions. What I will need to do here, we're just going to open up for questions, and let me check really quick here for any that are already there. Okay, just pulling these up here. All right, it looks like we have a couple of hands raised. Just one moment. Okay, pulled up our questions here. And I'm going to just start out with one about implementations. Okay, so one question was about annual assessment, whether or not there'll be a unique program type. No, not at this point. There's a program type that already addresses during program enrollment, and dates will help with the annual assessment piece. So hopefully that addresses your question. If you do have any further ones on that, let us know. Let me see here. And there will be help in identifying those clients that need annual assessment. By the way, there's some tools in the system for that. And then will the slides be available in the webinar? Definitely. We'll be sharing those. Okay. And lots of reminders that our slides was cut off. I apologize for that, but we did resolve that. Quite a few of those. Let's see here. I'm just scrolling through these. Okay, great, and a lot of celebrations that we can see the whole ones. And then, yes, once again, the copies of the presentation will be emailed out. Okay. A question, and this is a great question, about the HUD CSV export and XML. So the situation with the CSV and the XML is HUD has not finalized the changes to those yet. Okay. We are involved in their draft copy, the work that they've done where they've solicited comments from vendors. We're deeply involved in that. We will have the CSV and the XML as soon as possible. Right now, I imagine your SSV of grantees that need to export to the VA, they'll be fine the first week in November. We fully expect to receive these requirements in September as soon as possible, and we'll deliver those as quickly as we can. That said, for any of you who use XML or CSV for a regular import or export, please have that conversation with your advocate. We want an individual plan to take care of your needs. Let me go through a few others. A question here, can you still select the grant for each client if you want to? Technically you could. We will be writing the reports to look at the grants that fund the program at the time of enrollment. But if you want to specifically identify a grant, that is still available in the ClientTrack data model. It's just the HMIS compliance reports won't be written to look at that data. So if that affects you in a way that maybe you have further questions about, please let us know. Okay? Where do you download the data manual? That would be at HUD Exchange, formerly known as 1CPD about 2 weeks ago. So if you will, go to HUD Exchange, download those. If you run into a big problem with that, please email or contact one of us. We can send you a link. Right? Any changes to the HOPWA reporting logic? I wish. No, not at this point. Those of you who read your HOPWAs extremely closely notice that most of them expire in October of 2014. So we're expecting logic changes to those reporting soon. In the meantime, we've updated reports so that they look at the places for the new data standards. So we will probably be able to meet your reporting needs if you have any in October until we receive those. But if you have any more in-depth questions about that, that is a great one to put on your advocate's radar. Okay, let me go through here. So question here, and this is great, very detailed. Will head of the household be saved for a family account in addition to data for every project entry? Yes. So the question points to something we've done in ClientTrack. We actually separate out what a household is in the HUD world from what a family is in probably most of our day-to-day understanding, the common understanding of what a family or household is. And that data has usually been saved in both places in ClientTrack and will continue to be so. This gives you a lot of advantages on reporting and data accuracy. For most of us, this will not be a significant change. But if you think it might impact something in your own solution, that's definitely something you want to put on our radar. Okay? And that probably put that in your list of what to talk about when my advocate gets a hold of me. Okay. Okay, a question about how chronic will be calculated. So we have the logic specifically for that. That will be detailed in the release notes. So you can look through that. It's written very precisely. It should be able to tell you exactly how it's calculated. I also want to mention that we will have a view in the system. I apologize, this gets very technical, but we'll have a view that does it for you. This will calculate chronic homelessness and will give us an opportunity to display it on a number of forms and use it in reports and really make it easier for you to report on that data as well. Okay. Question about where's the best place to obtain the HMIS data model. That would be HUD Exchange or 1CPD I think is still up if you guys still have links to that. Okay, so a question here about, are there any changes that we need to prepare for on the administration side when we're talking about programs versus projects? And your big change will be to the setup data. So you already have your program set up in ClientTrack. There will be additional data you need to apply to your programs. Okay? And this would be updating project type if it's one of those ones that are changed. And if it's a services only project, then you will need to associate it, well, either state if it's associated or not with the residential, and if so, which ones. You will also need to look at the COC that program serves. That's a new data element. So there will be a few things you need to do, and in the setup data section of the release notes, we'll list those out for you. Okay, great questions, by the way. Definitely copy of material. Will grants be removed completely? No, absolutely not. And they will still be an option in reports and services. What we're trying to do is simplify what a user has to do for an enrollment. So administrators will still need to be very concerned about grants. Services will be a great way for you to distinguish between what one grant funded and what another one funded. Okay. Let's see here. A question about the CAPER. We have not received updated programming instructions on the CAPER, so you would expect it to keep the same format, but we'll support data showing up on that report, of course. We've had to make a few changes for that. But the report itself, none of the logic or the guidance has changed as of yet. I would fully expect that to happen. Okay. All right, let's see here. Okay, a couple of other things. Okay, I've got to wrap up here. Question about will this require an upgrade to SQL Server? No, no, that shouldn't. No assessment. All right, a question about disabilities, probably a little too in-depth to address here. So let's bring that up with our advocate. And I apologize, we do need to end on time. I want to respect your time. So what we'll do, I've got probably about half a dozen questions here. We'll pull those out and address those specifically. You are welcome to contact me. Many of you already know me. I'm seeing quite a few people I know in here. Or your advocate if you have more questions. And you will certainly have more questions next week as well. So thank you all for attending. I hope this was helpful and informative. And let me turn it over to Steve.
Well, on behalf of all of us that listened to this great and informative webinar today, I want to thank Sam and also thank his team for being so on top of and ahead of the deadlines for this update. And we greatly appreciate the time and energy and effort put into that and this information. We hope that this has been beneficial to all those participating today. Thank you for the great questions and your participation. We will be posting this on ClientTrack.com and this webinar, and also stay tuned to ClientTrack.com under the News and Events tab for future webinars. And again, we are grateful for all that you're doing to help your communities, and appreciate your participation today. And have a wonderful time. Thanks.